Misconception number 3, people never leave. So the average length of stay in Broadmoor is about 5.5 years, so it's a long time for a psychiatric admission. I would say there are many outliers. So as I said, when I worked in the high dependency unit in Broadmoor, many of the patients, the majority I'd say, probably won't leave hospital, which is tragic, because they have treatment resistant illnesses. So we've thrown lots of different high doses of antipsychotic medication, therapy, clozapine, which is like the strongest antipsychotic, and still they have symptoms. So those people will never leave, but there are outliers. Most people do make it through the system. What makes it complicated in terms of figuring out their length of stay is the fact that many don't leave directly into the community. They go to medium secure units, because medium secure units, which actually have far more patients in the country, mentally disordered offenders, than high secure units, they are geared up to have people have a bit of leave in the community, etc., etc. So it makes sense for more people to step down to medium security before they go to the community. The reason I'm mentioning that is it complicates the length of stay, because are you talking about the length of stay in Broadmoor, or are you talking about length of stay altogether in hospital? And to make it even more complicated, people can go back and forth. So you could deteriorate once you're in medium secure, become more risky, and end up going back to high secure. Similarly, you can actually go from prison to Broadmoor and back to prison, like Robert Maudsley did. And that depends on lots of factors, some of them being the actual section that you're on. So I don't want to bore you, I don't want to get too complicated, but very quickly, there's like a section 48, which is a remand section, which means that at that point, your decision hasn't been made if you're going to prison or hospital. And the whole point is that you have a test admission to see whether you need prison or hospital. Or you can have section 37, which is a hospital order, which means that the judge and the doctors have made the decision that this person only needs hospital, not prison, which is where most people in Broadmoor would be on that section. Or you can get section 47, which is where they've already been sentenced, so they're already prisoners, but then afterwards they've deteriorated. They go to somewhere like Broadmoor until their mental health's better, and then they go back to prison because they've got a prison sentence they have to stay to because they've actually been imprisoned.